We shall be looking at history taking in obstetrics. So, history taking in obstetrics is important because it enables the physician or doctor to have good information about the pregnancy, its cause, and also complications that may arise as a result of this pregnancy and some conditions which may arise to be diagnosed early. So, in history taking in obstetrics, a physician must have good skills in taking this history in order to be able to come across such condition and to gain much control of the pregnancy he is looking after. So you begin with the bio data, the name, the first name before the son name, the age, the occupation, the address, the religion. If she's a Christian, you ask, is she Catholic? If she's from Jehovah Witness, you ask if she's a Muslim. From this, you know a lot of things. Ask for the tribe, marital status, educational level, is it primary, secondary, or tertiary? Ask of parity, that's previous pregnancies that have reached 28 weeks. He asks of the last menstrual period, that's the first day of her last bleeding. He asks of expected date of delivery, that's of estimated gestational age. Secondly, you ask for the reason or reasons for her visit. It may be for booking, routine antenatal care, new complaint. Ask about how, where, when pregnancy was confirmed. Was it in the hospital? Did she discover it through a test strip? Problems since onset of pregnancy and treatment received. You ask of the number of antenatal visits, immunization received, drugs she has been taking, investigations done. You ask of her genotype and blood group if known. You ask of her HIV status, any new complaints such as excessive vaginal discharge, bleeding via the vagina, fever, etc., and clear as appropriate depends on the problem she tells you. So you ask of her past obstetric history. Detailed history of each pregnancy is important. You ask the year of pregnancy, duration and outcome of pregnancy, labor and puerperium. Puerperium is how good she recovered during the first few weeks of her delivery. You ask of the mode of delivery. Was it via the vagina or it was through a cesarean section? You ask of length of labor. Was it up to 40 weeks? Was it up to 32 weeks? Was it even more than 40, 42 weeks or so? Postpartum events, that's events after birth, such as postpartum hemorrhage, fever, etc. You ask of sex of baby and birth weight. You ask of days spent in the hospital before discharge. You ask of the present state of the child. Is the child alive or dead? So fourth is gynecological history. So you ask of the age at menarche, the age she reached before she started seeing her menstrual flow. You ask of length of menstrual cycle and period. Ask about history of menorrhagia, that's excessive bleeding during periods. Dyspareunia, which is pain during sex. Dysmenorrhea, pain during menstrual bleeding. 4. You ask of contraception. Does she take oral contraception? Has she ever been implanted with a contraceptive device? You ask details of abortion if she has committed any or if she has had any, to be clear. So you ask for past medical history. Ask about history of diabetes mellitus, hypertension, respiratory diseases such as tuberculosis, asthma. You ask for blood transfusions, which may cause rhesus iso immunization. You ask for previous surgeries such as myomectomy, which is the surgical removal of uterine fibroids. You ask for VVF repairs, that's vesical vaginal fistula repairs. You ask for prepares, how she was prepared for the surgery, etc. You ask for drug allergies. Is she allergic to any drug? Is there any drug when she takes she feel uncomfortable? She convulses or loses consciousness. So you ask of her family history. Is there positive history of diabetes mellitus in her family? You ask of history of hypertension. You ask of history of twinning. Do people in her family give birth to twins? So seventh is the social history. Here you ask of type of marital status. Is she from a polygamous home? And occupation of the husband. Is the husband a farmer, a banker, a doctor? You ask of smoking of cigarettes. Does she smoke? Does she live in an environment where people smoke? Do people around her smoke? You ask of illicit drug use. Is there any drug she uses without prescription? You ask of alcohol consumption. Does she consume alcohol? What's the quantity? So you ask of the drug history. Drugs of importance such as antihypertensives, oral hypoglycemics, tetracycline, phenytoin, and warfarin. You do systemic review for her. Here you check other systems in case they have anything to affect the pregnancy. So then you make your own summary. You consider the name, the age, the gravidity, that's the number of pregnancy, the parity, the number of pregnancy that has attained 28 weeks. You ask for estimated gestational age. You consider important findings, investigations you have done. So in summary, you say, I have presented Mrs. AM, a 34-year-old gravida for para 2, one alive, estimated gestational age 22 weeks, who is here for routine antenatal visits. She complained of generalized body pain today. She has had her PCV, that's packed cell volume, urinalysis, genotype, and blood grouping done. Thanks for listening.